Welcome to Planning for Medicare. We're really glad you're here with us tonight because we know that this can be a pretty complicated and overwhelming subject. And before we get started, Susan, if you could just go to the next screen, I'd love to just quickly introduce the team. Many of you guys already know us, but each of us brings a unique expertise, but together we share one vision, and that's to give our clients clarity and confidence and the support that they need to make their best decisions. And tonight we're really honored to have Sue Flanagan here with us from Blue Cross Blue Shield of Massachusetts. She's been with them for over 20 years. That's how many years of Medicare experience she has. And she's going to help us tonight understand better the ins and outs of Medicare and help us simplify what can really feel very overwhelming. So throughout the process, she is open to questions. As we go along, she'll make sure to pause kind of at each section. So if you have any questions, feel free to put them in the chat. And then at the end of that section, I will ask her those questions and she will answer them in real time. We really want to emphasize that this is a judgment-free space, and every question is important and no question is silly. So with that being said, Sue, take it away.
Thank you. Thank you so much for having me. Thank you, everybody, for joining. So we'll get started. What we're going to do is this presentation is really broken down into two sections. The first section is the meat of today's presentation, which is all about Medicare and the types of plans that go along with Medicare. The second section only takes a few minutes to go through, and this is, well, what if I need coverage before Medicare eligibility? And I'll just give you some tips in that section. But regarding the material, the Medicare section is really where we're going to dig in. There is a lot of information to cover. It's all general information, but it's still detailed information. So even though I work at Blue Cross or for Blue Cross, it's really not Blue Cross information. It's going to help you understand when and how to enroll into Medicare. Once you're on Medicare, what are the weights and balances between Medigap versus Medicare Advantage plans? So this slide right here is a very high-level overview of really what we're going to talk about in the Medicare section, but it's also going to show you the landscape. So what this slide is showing you right here is that Medicare is always your starting point. You need Medicare Parts A and B. And when you think about that, think about an 80-20 plan. So to oversimplify Medicare, think about it's an 80-20 plan with some deductibles. I can go to any doctor, any hospital that takes Medicare, and most do. So you could stop right there and do nothing else. Most people want more coverage than Medicare alone. And if you do, the number one question you first want to ask is, do I have group retiree coverage or medical coverage from a former employer? Or from my employer. So do you work for the federal government? Does your spouse work for the federal government, the state, a company for 20, 30 years? Your question should always be, do I have that group retiree coverage? If you do, you're typically joining from that and not on your own. However, most people don't have that option, so they're going to be looking to buy individual coverage. And once you're leaving employer coverage and on Medicare, everything is an individual decision. So your spouse could pick one plan, you could pick a different plan. And there'll be two distinct pathways for you to go down, and that's what we're going to cover today. So we're going to take each one of these boxes one at a time. But the first pathway we'll go down after we talk about Medicare will be Medicare supplement plans. And these are plans that pick up where Medicare left off. So they're always going to pick up that 20%, let you go to any doctor, any hospital, but they don't add in a lot of extras. So under that pathway, you're going to buy a separate prescription drug plan. So that pathway is typically the most expensive monthly premium pathway to go down, but the least amount of money out of your pocket as you see those doctors or those hospitals. Then a whole different way of doing things, you see the or in the middle of the page, are Medicare Advantage. And on Medicare Advantage, you might think of them as your HMOs, your PPOs. They're more familiar. They like the plans that you have while you're working. It's one card, medical prescriptions extra. These plans, the most popular plans, are usually plans that are zero premium or under $100-something. So they can range from $100 to a couple $100. But again, the most popular plans are usually those zero premium or lower cost plans. So there's weights and balances to both sides, and that's what we'll go through. As I said, we'll take each box one at a time, but we're going to start with Medicare first because what we find is if you understand Medicare, everything else makes a lot more sense. So Medicare is health insurance provided by the federal government. It's broken down into two parts. We have Medicare Part A and Medicare Part B. Part A is your inpatient care. So that's your hospitalization, skilled nursing. This is premium free for most people. And then Medicare Part B is all of your doctor care and your outpatient services. This is $185 per person per month in 2025. If you're collecting Social Security, it will come automatically out of your Social Security check. If you're not collecting, you'll work it out with Social Security to pay that. If you are in a higher income bracket, which Medicare or Social Security defines as $106,000 as an individual or $212,000 as a married couple, then your Part B does start to go up, and I'll have a resource slide in the back that we can go through. But for most people, it's that 185 coming out of their Social Security check. And then with Medicare, as I say, you can go to any doctor, any hospital that takes Medicare. Most do. You don't need referrals. So if you want to see a dermatologist, cardiologist, you can do that. If you want to go to California or Connecticut, you can do that. It really makes no difference. Medicare is a nationwide coverage. Again, it will always be there for you when you're sick, problem diagnosis, just doesn't cover all of the cost. So again, it's that 80/20 plan with some deductibles. We'll go through what Medicare covers, what it leaves behind, but the next few slides, we're just going to talk about really when and how to enroll into Medicare, because this is where a lot of questions come up. So, Mary, I know you mentioned earlier it's a process, and it is a process because as soon as somebody is turning 65, they've got a neighbor, they have a friend, they're telling you you have to take Medicare, and that actually may or may not be true depending on your own personal situation. So what we do is we find that most people will fall in one of the next three brackets that I'll go through. So the first would be if you're turning 65 and you're already collecting Social Security, then your Medicare card should come automatically to you about 3 months prior to your 65th birthday, and it will always start the first day of the month of your 65th birthday. So if somebody was born May 20th, their Medicare would start May 1st, and they would see that card come automatically a few months prior. If somebody was born on the first of the month, for some reason, Medicare starts that person the first of the previous month. So example, May 1st birthday, their Medicare starts April 1st. And again, they'd see the card come automatically. Now, that's the only time the Medicare card's going to come automatically. Outside of that, if you're turning 65 and you're not collecting Social Security and you want your Medicare to begin, you do need to initiate that process, and you should do that 3 months prior to your 65th birthday. And then many people are going to work past age 65. So if you're going to work past age 65, sometimes the question is, do I have to take Medicare? And the answer is going to depend on a few factors. The first one is, what is the size of your employer? If your employer is under 20 employees, yes, you need to take Medicare, both A and B. If your employer is over 20 employees, and you can delay signing up for both your A and B with no penalty, as long as you have group insurance from the employer with 20 or more employees for whom you or your spouse are actively working. So I read that bullet because it's important with the wording. So when we say spouse, we mean spouse, it's not partner. And when we mean actively working, we mean actively working, not COBRA. So an example might be, let's say you are working at Mass General Hospital. Well, we know there's more than 20 employees at Mass General Hospital, and you're actively working. You're working, you have your health plan there. If you turn 65 and you say, I want to work until I'm 70, you can do that. You want to work until you're 80. You never have to take A or B if you have the insurance to the employer and you're actively working. When you retire, you go down to Social Security, you say, I want to sign up for Medicare A or B. A and B, I'm sorry. And they're going to say, well, where were you at age 65? You're going to say, I was actively working with health insurance through my employer. You'll have a form for the employer to fill out to sign you up, and you'll go on to Medicare without any penalty. Now, many people, if you're working past age 65, will sign up for Part A because Part A is free or premium free, and just feel more comfortable getting in the system. So many people will sign up for A. The employer plan is still going to be primary, so that A may not do anything for you. Sometimes there's a coordination of benefits if you end up in the hospital, but you don't want to sign up for B because you don't want to pay that premium. Now, the caveat to what I just said is that if you have a high deductible plan and you've paired it with a health savings account, so you're taking pre-tax dollars out to fund that high deductible, you do not want to sign up for Medicare Part A because you're not allowed to be on any other plan other than the medical plan that's paired with that high deductible. So for anybody that wants to continue to work past age 65, continue to contribute to an HSA, as long as you have the insurance to that company, don't sign up for the A or B. If you don't have that, you can decide to either sign up for A at the time you turn 65 or wait until you retire. It really doesn't make that much of a difference. I'm going to go through two more slides and then we're going to be done with the Medicare section. So we only have a small group. I know, Seren, we said you can put your questions in the chat, but if you just want to ask them out loud, feel free to also do that, put them in the chat, whatever you're comfortable with. So just to conclude with Medicare, you really don't need to know these details of Medicare, but it's helpful to have a base of understanding of, okay, if I only had Medicare, what would my coverage be? And it's helpful to know when we start to talk about the Medicare supplement plans. So let's say you had no other insurance other than Medicare. If you went into the hospital, you'd be covered your first 60 days after you paid an initial deductible of $1,676. If you were there more than 60 days, you start paying a coinsurance of $419 a day, and at day 91, you start to pay $838 a day. Also, under Part A is the skilled nursing facility. You do need to be admitted 3 days prior. As long as you have that, then you'd be covered at 100%. If you were there at day 21, you start paying $209.50 a day. Now, this is that Part A of Medicare, the premium free, and it also works off of what we call a benefit period. A benefit period starts the day that you enter a facility and ends when you've been out for 60 consecutive days. So it would be possible to pay that deductible more than once a year. An example might be, let's say you were in the hospital for 10 days and you left. You're going to get that bill for $1,676. If you're only home for a few days and then you go back in, you're not going to pay that deductible again. They're going to pick up where you left off, day 11, day 12, day 13. But as soon as you go home for more than 60 days, at that point in time when you go back into that hospital, everything resets. It's a new admission, day 1, day 2, day 3, and that's how you would pay that deductible once again. Now, the Part B is a lot easier to understand. That was that premium portion, the $185, and that's for all of your doctor care, whether you're in or out of the hospital, and then all of your outpatient services. It has a calendar year deductible, and that's $257. So you'd pay the first $257 of your medical care. Once you've met that, the Medicare pays 80% and you pay 20%. It does not include prescription drug coverage. It covers you anywhere in the US and our territories, but not worldwide. And Medicare doesn't add in like routine vision, like money towards your glasses, routine hearing, hearing aids, or dental care. Um, and when you do go on to Medicare, so if your spouse is on Medicare, your family members, you should get a Medicare and You handbooklet late September every year, and it should spell out all this information. So I'm just going to pause. I know it's a lot of information. I don't see any questions, but I'd love for questions or comments if you have any. No?
Just make sure to unmute yourself if you're on mute.
If I'm already collecting, actively working, have insurance, I'm going to retire in a year. Is there any recommendation about when you go to Social Security to report that you're going to retire?
Sure. Are you will you be Medicare eligible? Will you be 65 or older when you're retiring?
Yes.
Okay, so sure. So as soon as you know when you're going to retire, you can contact Social Security about 2 to 3 months prior. So you don't want to go 4 months or 6 months. The 2 month is typically a good, they say 2 to 3 months.
Two to
Sometimes I've
three.
heard sometimes they tell people to come back after the 3 months, to come back at 2. So I
Okay.
would stick with the 2. And you
Thank you.
can do it online too.
Okay, great. Mhm.
Thank you for the question. All right, so we'll keep moving forward.
I had one
Oh,
thing, Susan,
yeah,
sorry.
sure. No,
So,
perfect.
so my husband and I are planning on waiting till we're 67 to start getting
Mhm.
social. But next year, I'm planning to retire. He's already retired, and we've both been on my plan at work. So once that ends, we can do Medicare, but we can hold off on doing social. We don't have to do social to get Medicare.
That's correct. So
Okay.
Social Security and Medicare, the only thing that they really have in common is that you sign up through Social Security to get onto Medicare. And once you're collecting that Social Security check, they take that Medicare premium out.
Yeah. Okay.
But you can go on to Medicare at 65 and not collect until you're 67 or
Okay.
whatever you want to do. Yeah. And
Great.
if that's
Thank
the
you.
case, you'll work it out with them to pay that Part B premium. And then when you
Yeah.
finally do take Social Security, they'll start to take it out of that premium.
Okay. Makes sense. Thank you.
You're welcome.
Susan, I have a question. I am taking Social Security now. I have Medicare Part A. I'm over 65 and I'm going to be retiring at the end of January. So it sounds like I should get going, making some decisions about the next steps. Is that right?
That's correct. So if you're retiring, you said at the end of January, so February 1st.
Yep.
So around December, I would contact Social Security to make sure you get set up on that Medicare Part B for February 1st. So just keep in mind, Medicare always starts the first day of the month when you decide your retirement. So Medicare, based on what you do, it's either going to start January 1st or February 1st for you. So
Okay.
great.
Thanks
And good luck on your retirement. It's exciting.
so much.
Coming up.
I cannot wait.
Good.
Congratulations. I
Yeah,
can't wait, and I have a year to go.
Oh no.
not that long.
A friend of mine has had a calendar and she checked off the days going to retirement.
Yeah, it's exciting. Great. So now what we're going to do is we're going to look at the types of plans that you can buy. So the first one is going to be what we call a Medigap plan or a Medicare supplement plan. And if you've done some reading, it can be really confusing because those two terms mean exactly the same thing. They're a type of health plan that you're buying through a private company like Blue Cross, like another company, that fills in the gaps where Medicare left off or supplements where Medicare left off. So with these plans, Medicare is your primary insurance, and you're buying a secondary insurance from Blue Cross or whoever to pick up that leftover amount. So Medigap plans are always going to pick up that 20% that Medicare left behind. But depending on the product you buy, they may pick up different deductibles, and we'll see that. If you're living in Massachusetts, we have 3 Medigap plans that are standardized by the Division of Insurance that I'll go through. If you live in a different state, the rest of the country has 10 standardized plans that you can choose from. Regardless of what state you live in, the concept is still always going to be the same. Medicare is primary, your health plan is secondary. The health plan is waiting for Medicare to pay. It has to be a Medicare benefit. Once Medicare pays, the secondary plan that you bought is there to help pick up that leftover amount. So when you go to the doctors or the hospitals, you always show 2 cards. Medicare pays first. Health plan pays second. What that means is you don't have to call a health plan and say, can I see your provider directory booklet? Does my doctor take this plan? You don't have to ask those questions. All you need to know is, does my doctor take Medicare? If they do, then they take this plan, because all the plan is a payer. Medicare pays first. You send the health plan enough money every month so that when claims come in, these plans just pick up that leftover amount. They don't add things in that Medicare doesn't cover, so they're just following Medicare's guidelines. So you're not going to see the money towards glasses, dental, or hearing aids, things like that. Here are the 3 plans in Massachusetts. We have Supplement Core, Supplement 1A, and Supplement 1. Most likely, you're not going to qualify for the Supplement 1 plan. You may, depending on your situation, but to qualify for the Supplement 1, you had to be eligible for Medicare prior to 1/1/2020, or so that means that you had you're qualified for disability, or you were 65 before 1/1/2020. So if you say, well, I'm just turning 65 next month or in a year from now, you're not going to qualify for that Supplement 1, but you don't need to worry, because the Supplement Core and 1A are still there. The Supplement 1 plan, just to kind of go through it, that plan right now is about $260 a month. And what it does is it picks up everything that Medicare left behind. So for $260 a month, you look at those check marks, it means when you go to the doctor, lab, x-ray, hospitalization, no co-payments, no cost. So it's a very predictable cost. But the next plan down, the Supplement 1A, it's almost its twin. And the only difference is that somebody would pay the Part B deductible every year. And in 2025, that deductible was $257. So let's think about the premium here, $220 times 12. You're going to pay your first $257. And then after that, every time you go to the doctor, lab, x-ray, everything's covered at 100%. So you're on with your financial advisors. If they did out the math for you, the Supplement 1 is, the Supplement 1A is a better financial decision anyway than that Supplement 1 plan once you do the math, because they're exactly the same. You just have to pay that one-time deductible every year. And then the Supplement Core plan, that would run about $120 per person per month. And when I'm giving you these numbers, I'm sorry, I should have said it ahead. Every company will have a different monthly premium because they have different membership. But the premium of these plans, they're group premium. So for example, if you came to Blue Cross, everybody pays the same. It's not, I came on with these type of claims or these conditions. All you need to do is have Medicare A and B and live in Massachusetts. There's no pre-existing conditions or health screenings or underwriting. So again, Supplement 1A, about $220 a month. Starting there, it can be different from company to company. Covers everything Medicare covers at 100% minus that Part B deductible. The Core plan, almost like the Supplement 1A, if you are not admitted in the hospital. So if you're seeing your doctors, outpatient care, labs, x-rays, Same thing, you'll pay your first $257, but after that, every time you see a doctor, lab, x-ray, everything's covered. The difference lies at the top for the deductible. So on the core, if you do enter the hospital, you would pay the $1,676. It would be the same whether you were there for 60 days or 150 days, same as the other plans. Skilled nursing, you do need to be admitted in the hospital 3 days prior on all of these plans, and then Medicare covers you the first 20 days. But at day 21, you would pay the $209.50. So Supplement 1 covers everything Medicare left behind. 1A covers everything minus the $257. The core, you're going to have the hospital deductible, skilled nursing at day 21, and the first $257. If you move your eyes to the bottom 2 rows, you can see care outside the U.S. So this is an exception to the rule. Medicare does not cover you outside the U.S. The 1A and 1 are regulated to cover you outside the U.S. Typically what happens is you need to pay upfront, come back and be reimbursed based on your plan design. The core doesn't have a check mark, but many health plans do cover you outside the U.S. They added that in, but these are just the regulated benefits. So you'll never have less than what's on this screen. Now, regarding prescription drug coverage, these plans, this legislation, they cannot add in the prescription drug coverage. So it's not covered, and you would need to buy a separate prescription drug plan. If anybody is going to live in a different state when you turn 65, in the other states, same concept. You're going to look at that monthly premium, what it's picking up, where Medicare left off. Plan G is most similar to the 1A that I just went through. But what you would want to know if you were enrolling in this in another state is that other states do have underwriting guidelines and very specific times to enroll. So you would want to check that within the state that you were residing in. So that's it for the Medigap plan. So I just want to stop here, see if there's any questions on those. No.
Susan, I'll ask you a quick question kind of on behalf of our clientele who tend to be global travelers.
Mhm.
There's always someone somewhere going somewhere. I think on the next slide you had shown, it said something about foreign travel. Can you just talk a little bit more, like if we are retiring and we want to be traveling outside of the country, is there, like, tell us a little bit more about what we may need to think about as we're making these decisions.
Sure. So for the most part, most of the health plans are going to cover you outside the US, especially for emergency and urgent care. But what will happen is you need to pay up front, you need to come back, submit the claims, adjust the currency conversion. So it's not a concierge type model. But if you say, well, I'm not worried about that, I have it on my credit card, I'll deal with it, I have enough money, that's fine. Like if you're on the 1A and let's say you're on Blue Cross, the core, we cover you worldwide. So you will be reimbursed minus whatever your, according to your plan design. However, if you don't want to deal with that, at Blue Cross, I can speak to, and I'm sure there's other medical travel insurances out there. I'm just not that familiar with all the different carriers, but ours is called Geo Blue. And that plan, what will happen is if you're outside the US, it's a very inexpensive policy and it will act as like a concierge. You're not going to have to pay up front. It will take care of that. You'll be able to find an English speaking doctor. They have accredited doctors. They'll make the appointments for you. You'll be able to have telehealth. So let's say it wasn't something serious and you don't want to waste your day finding a doctor. You're able to have a telehealth appointment outside the US. So many people swear by our travel insurance called Geo Blue. You don't have to be a Blue Cross member of any of our products to buy it. So that is also an option. And as I said, I'm not trying to sell Blue Cross. I'm sure there's other carriers, other medical travel insurances out there. But that's typically the GeoBlue is what I know for that. And it's a very inexpensive policy that will last a whole year for you when you enroll in it.
Thank you. That's great.
You're welcome. So now we're going to start to talk about the prescription drug coverage. So let's say you go on to Medicare and you go on to a Medicare supplement plan, and now you know that doesn't take prescriptions. You might think, okay, I'm going to call Social Security, say, give me Medicare Part D, the same way you had Medicare A and B. But Part D isn't that way. You need to choose Part D through a private insurance company. And what you pay for Part D is what that private insurance company is charging for their monthly premium. So all Part D plans, whether you choose Blue Cross, a different company, they're all going to follow a standard outline of coverage that's set by Medicare. And there's 3 levels of coverage. It's called the deductible, initial coverage phase, and catastrophic. Now, based on these levels, the plans may have different deductibles, different copays that you pay for your medications, pharmacy network. All those things in the membership help determine the monthly premium. So the premiums in 2026, I saw them came out in the Medicare and You handbooklet. The lowest plan this year is $8 a month, and they go up to almost $200 a month. But whether you choose an $8 plan or a $200 plan, it's still that same outline of coverage. So to really understand which one would be best for you, you can call Medicare. I'll have a resource in the back. You can call a number called Mass College of Pharmacy. You give them your medications, or you just do it online yourself, and you find the best Part D based on your medications in the computer system. So it does all the work for you. So for example, if you find a $20 plan and the copay for your medication is $50 a month, now that's a $70 plan compared to, there's just different math that goes into it, and you don't need to call every company to do that. It's right online through Medicare.gov. Some people will say, well, I don't take any medications. Do I have to take this plan? No, you don't. You never have to take a plan. But if you don't have what Medicare calls creditable coverage, prescription drug coverage as good or better than a Medicare Part D plan, and then you later on want to get onto one, you'll get a late enrollment penalty. So my thought is, if you don't take any medications, it's always best just to take the cheapest plan. Each year you can change it once a year during the annual election period, and you'll avoid those penalties. Here is the Part D model. In 2025, the annual deductible is $590 if a plan has one. It could be less. It could only be on certain tiers of medications, but it could never be more. Once you've hit that deductible, if there was one, you enter something called the initial coverage phase. That's just like your work plan. So you've looked up your medication. Oh, this Levoxyl thyroid medication, I pay $5 copay, or this medication, I pay $10 or 10%. So you're paying some cost share. And then at the end of the day, if by paying a deductible in that cost share in the initial coverage, if you ever paid $2,000 out of your pocket in a given year, then for the remainder of that year, you're covered at 100%. So if you've heard years past, what's the donut hole, the coverage gap, all those things have gone away. Part D is much cleaner, easier, and a better benefit for a lot of people. So just to kind of recap, we talked about Medicare 185 per person per month. That's always your starting point. Then we talked about the supplement plans ranging from 120 to 260 something. No copays, any doctor, any hospital that takes Medicare. But those plans didn't take prescription drug coverage. So if you're going down this pathway, you need to buy a Part D plan. Average premium is about $35 or so, but they can range across the board. And I always say, like, sometimes when you're in this presentation, you might have came on today and said, I didn't even know Medicare had a premium. Now I'm talking about a couple $100 for the supplement and some more for the drug coverage. And if you're saying I would hold off if you're worried, and we'll talk about the Medicare Advantage, which was a lot less expensive, but you pay some co-payments along the way. Or maybe the supplements have given you some peace of mind and you say, you know what, for 200 something dollars a month, I know I can go wherever I want, have everything covered, and no worries. So everybody has a different take on the weights and balances of these pathways. And what we find is that once you do the work and you pick the plan, most people are very happy with the plans that they choose. And if you're not, you're just really probably on the wrong side of one of these paths and you can change. So nothing's a lifetime decision. You'll be able to change every year, October 15th through December 7th, and we'll go through that. But before I start on the Medicare Advantage section, which is much quicker, does anyone have any questions on anything that I've gone through? No? Okay.
Again,
So
make
now,
sure if you're on mute, you can unmute. Sometimes people think they're not.
Yeah, I got a little confused with the when you were talking about the supplements. So, basically, yeah. So basically, that's going to be per person, right? The between 120 to 260 per person a month if you get a supplement. Is that right?
that's correct. Yeah.
Right.
On
And that
top of your Medicare.
right. And plus, so that's also and in addition, the Part B, right? And that's like 185. Okay.
Correct. Yep.
Right. And then the prescriptions you said are on average 35 per month.
Mm-hmm.
Okay.
Yep.
Okay, well that's not nothing.
No, it's not. That's what I said. So you're never going to get rid of the 185, because you always need the Medicare, continue to pay the Medicare. But the Medicare Advantage, which we're going to talk about next, these plans, the most popular ones are zero premium plans, and that you have your medical prescriptions, probably some dental in there, some money towards eyeglasses, hearing, within these. And then the next question is probably, well, how? Why was the other side so much money and now this side is a lower premium? And it's just the way that the plans are funded. They're funded very differently. So when we talked about the supplement, Medicare was your primary health plan, brought in enough money every month from the membership just to pick and pay that leftover amount. But here, when you join a Medicare Advantage, which are those HMOs or PPOs, let's say you join Blue Cross, for every member that comes onto our plan, we may receive around $1,000 per person per month. So we're not offering a plan. Maybe we have a zero premium plan and you're not paying us any money, but we're getting this $1,000 a month. And what we're doing with it is we're going to contract with doctors and hospitals. We're going to give you all of your Medicare covered benefits, plus additional benefits that Medicare doesn't cover. So the drug coverage is included, the money towards the glasses, the dental. In exchange for that, now when you go to those doctors or those hospitals, you no longer show your Medicare card. If you showed it and they billed Medicare, Medicare would say, hey, we already prepaid that plan to take care of you. So you show your one health plan card because we're managing those funds. We pay the claims from that pool of funds that we have, and you're always going to pay a copayment or a cost along the way. So even though you'll always have Medicare covered benefits, you never lose those. Everything we drilled down in that previous section no longer applies. This is more like your work plans. You're going to look, what's my monthly premium? Okay, what do I pay when I go to the doctor? What's my copayment when I go to the ER? What's my copayment when I go to the hospital? So you'll have your options between HMOs and PPOs. So an HMO, health maintenance organization, you need to choose a primary care doctor and then have referrals. A PPO is a preferred provider organization. You never need referrals. You stay in network to contracted doctors, you'll pay less, but you can go out of network to any Medicare provider. You just pay a higher cost share. Example, at Blue Cross, we have 4 HMOs and 3 PPOs. If you called another carrier, they would have the same type of portfolio. So you're going to have a lot of choices to look at when you look at these Medicare Advantage plans. But just to kind of give you an idea of how they work, none of them have medical deductibles. So while we're working, a lot of us are used to having, a $2,000 deductible or $4,000 deductible before we start paying co-payments or cost. These plans right away, there's no medical deductible. So when you're always just paying a co-payment when you see these providers. So let's say last year you said, well, what was my history last year? And you look and say, well, I went to the specialist 10 times. So you look at the plan and say, what's my copayment for that specialist? All right, it's $40. So if you went to the specialist 10 times, $40 times 10, that's $400 a year. You made out great. You had a medical plan, you had the prescription drug coverage, you probably had money towards glasses, fitness, weight loss. So that person did great that year. Then they carried it into the next year. Now they're in the hospital, skilled nursing, labs, x-rays, MRIs, chemotherapy. So they're having a bad year and they're paying these costs all along as they go. Each one of these plans will always have an out-of-pocket max. That's the most you would pay for your medical care in a given year. So when you're looking at them, you want to also know, well, what's my risk factor if I have that bad year? Such a small percentage of people ever hit those out-of-pocket maxes, but they're there for you as a protection. So maybe some typical ones are 3,400, 6,000, 10,000. They're never going to be $20,000, $30,000. But you want to just look at what those out-of-pocket maxes are. So every year, it's not a lifetime commitment. You just want to think about what plan is going to work best for me. And when you first go on to Medicare, so when you're leaving your employer plan or you're first going on to Medicare, and you know when your Medicare effective date is, let's say it's February 1st, you go down to Medicare, you say, sign me up for A or B starting February 1st. As soon as you know when your Medicare is going to be effective, you can start to join a plan up to 3 months prior to start the day your Medicare is effective. So there's no lapse in coverage. So you have this initial eligibility to join. Outside of that, you can relook at your plans every October 15th through December 7th for January 1st effective date. So every year, all the new plans are announced on October 1st. So tomorrow there'll be the announcement. What are the new changes? What's happening? People can relook at their plan. If they're happy with their plan, they don't need to do anything. If they want to change their plan, they can do that every October 15th through December 7th for that January 1st effective date. In Massachusetts, the Medigap or Medicare Supplement plans, they have continuous open enrollment. So in Massachusetts, we're lucky. People can swap back and forth between these Medicare Supplement and Medicare Advantage every year, October 15th through December 7th. If you live in a different state, you would have to check the Medicare Supplement when you can change those plans. But you can always change your Medicare Advantage and Part D every year. Outside of that, I always say, if you're not happy with your plan or you're in a situation, just call your health plan. If you qualify for one of these special enrollments, they'll let you know and help you out. On this slide is a resource slide. This is where I mentioned earlier, if you're in a higher income bracket, that you will pay more for Medicare Part B and you will pay more for Medicare Part D. There's a surcharge on it. The way that they do this is they look at your last tax return. So right now we're in 2025. So they're going to look at your tax return from 2024. So it's almost a 2-year look back. And that's how they assess this. They look every year and it can change every January 1st. Now, somebody might say, well, I was working and now I'm retired. I'm not making that money. That is a life event. So retirement, divorce, death, those are all life events that you can appeal that. But if you do nothing, again, it always is being looked at every year and being changed January 1st. And so, also nice leeway to say, talk to your financial advising team because you can see that there's some implications 2 years prior or every year on how this may affect you with paying that Part B premium, selling a house, things like that. Um, And then some other helpful resources, Medicare, Social Security, Shine. These are people at your local council on aging that will sit with you one-on-one closer to the date. Mass College of Pharmacy, if you have questions on medications, choosing a Part D plan, and the Blue Cross number and our website. So when you're closer to the date and you're trying to choose a plan, you could call Blue Cross, you could call another carrier. You're going to hear the product information, look at the plans that the companies offer. And I know it's a lot of information right now, but I promise when you sit down and you have that product information in front of you, it will all become kind of come back and even be more clear than it is tonight. So you'll say, oh, I remember I need to have my Medicare. And now from Medicare, I can choose two pathways. Supplements more money, but I have no copays, no worries, but I need to buy a separate drug plan. Or I'm going to go and buy a Medicare Advantage plan, much lower premium medical prescriptions all in one, pay some co-payments, but I'm going to check my out-of-pocket max to make sure that that plan, I'm comfortable with that risk factor. So that is it for the Medicare section. Before I go into the next section, I'm just going to stop and see if there's any questions or anything anybody wants to add.
Susan, I'll ask a quick question if nobody else wants to go. Do you find people bounce between the supplement and Advantage each year, or it's sort of like they go to Advantage and kind of look at Advantage plans each year and kind of stick in that route?
I typically I find I mean I'm not sure if it's backed in science, but typically when somebody's in the Medicare Advantage, they're usually if they're usually changing within the Medicare Advantage world. And the only reason that they're going to go over to the Medicare supplement is if they become have a lot of costs based on their healthcare needs and somebody says go to this Medicare supplement. Why are you paying those co-payments? You're going to make out better here. But it's not, you can put a lot of work and effort into it. But at the end of the day, let's say you have some medical conditions, it can really average out. For example, I've met with my friend's dad, my friend and her dad, and at the time, he seemed like he didn't have any medical issues. We put him on the Medicare Advantage plan. And then all of a sudden, throughout the year, he had an eye issue. He needed to do this and he needed to do that. And then all of a sudden, I felt bad. Oh, I wish I kind of put him on the Medicare supplement plan. And I did all the math out. It just ended up being even. So, you know, you pay lower, you pay as you go, you pay higher, you don't pay as you go. So one time, maybe for 10 years you pay low and all of a sudden you get that bad year. So it's really just what you're comfortable doing. Any other questions? And you can always talk to your financial advisor about have that conversation about your health or, do I want to have look at these out-of-pocket maxes and just plan for that and pay that lower premium? Or do I want to plan with the higher premium knowing that's a very predictable cost with no copays,
One last quick question. I see a lot of dental expenses in older clients,
Mm-hmm.
implants. all kinds of things going on. So dental, and then also hearing is very important for our
Mhm.
brain. And so a lot of us get to the point where we might need a hearing aid. Do you find one of these other options tend to be better in kind of covering some of those extra costs?
So definitely the past few years, the Medicare Advantage plans have added a lot of extra benefits to the program. So, for example, some plans were giving $1,000 towards dental or $1,500 towards dental. But these plans change every year. And if you read some of the news that for the Medicare Advantage, you would expect this year from the news to say that some of those supplemental benefits, like money towards dental, may be cut because of, funding and other things. So the last 5 years, they were definitely in the Medicare Advantage. We'll see what they are come 2026. But Medicare supplements have no coverage towards dental at all. So the Medicare Advantage is always going to be better, but what's in there, you'll have to look at. In dental, many plans offer standalone dental, but just like your work plan with dental, we're always a little upset with dental because when we pay for our medical, we know that there's no limit when we have a condition, it's covered. For dental, no matter which dental plan you pick, I'm not surprised that you're seeing costs because maybe you're paying a dental plan, but the most the dental plan is ever going to pay out is $1,500 or $2,000, and now your procedure is $6,000. So it's kind of not, it's not the same feeling as medical because there's a limit to what the dental will pay out. For hearing, though, the Medicare Advantage plans typically always offer you to be able to get a discounted hearing aid or buy a hearing aid through one of their providers. I know on our Blue Cross Medicare supplement plans, we have a rider that you can buy vision and dental, and it's about $2 in change per month. So it gives you that same type of dental and vision. So I'd say for the dental and vision, both sides, you'll be able to find it. For the dental and vision, I'm sorry, I'm tongue-tied, not dental and vision. Vision and hearing, both sides will give you that. But dental on the Medicare supplement plans, you're not going to find it. So sorry for my late evening tongue-tied. Okay. Any other questions? No. All right, so we're just going to take a minute to go through the last section, and that's just well, what if I need coverage or my spouse needs coverage before Medicare eligibility? What are the options? And really what the options are, what you have access to, the benefits and the costs that you want to pay. We have them in order of what typically works best for this time frame, but it's usually a very expensive time frame for a lot of people. So spouse or partner plan is always the best. And that would be, let's say you were working, you had your health plan through your employer with your spouse. All of a sudden, you no longer have that because you retired or whatever the circumstances were. If your spouse is still working, that's a qualifying event for you to go onto your spouse's plan. And that's typically the best bet because the employer is paying some portion of that premium. Not everyone will have that option, so then you would look to COBRA, which is temporary continuation of your group coverage. Employees are generally eligible for up to 18 months, spouse or dependent children up to 36 months. Qualifying events could be termination of employment, divorce, legal separation. You can always check with the HR regarding this. But COBRA is very easy because it's the same exact plan that you had while you were working, but now you're just paying 100% or 102% of that rate. So you know your COBRA plan, you know the cost, you can compare it to what we call the direct pay market. That means you're calling Blue Cross or one of the other carriers directly, and you're saying you want family, cut, two-person, individual coverage. They're going to take the oldest person in the group and your zip code, and that's how they quote the plans. So you could look at those plans and compare it to the COBRA. Usually the COBRA is going to be more financially advantageous than buying it on your own. Not always the case, but typically it is. If you qualify for any assistance and they're not looking at your assets, just your income, you can buy a subsidized plan through the Mass Health Connector, and that would tie you over until you're Medicare eligible. So that doesn't carry into Medicare eligibility. And that is it. So Catherine, I want to thank you so much for coordinating this and inviting me on. I really appreciate it. Sarin, thank you so much. And everybody, thank you for joining and spending your night or an hour with me tonight. So I'm going to turn it back to Sarin and Catherine to close. So thank you.
Thank you, dear.
Thank you.
Thank you. It was lovely. I know I learned, I've listened to this presentation actually a couple times, and I literally learned something new every time I listen to it. So thank you so much, Susan.
Oh, thank you. Have a good night, everyone. Thank you
Thank
so
you,
much.
everyone.